Okay, we'd like to welcome everyone in tonight for our Momentum Chiropractic Monthly Health Talk. I'm Dr. Nico Rocco. Joining me tonight is Dr. Thad Swales, as always. And tonight's topic we're going to be talking about is chronic inflammation and its role in your health. Chronic inflammation is something that not a lot of people are aware of. When you tell them inflammation, they're aware of what's known as acute inflammation, and we're going to get into all this and make the difference between the two. But it can be very detrimental to your health. It can really slow down your progress as far as chiropractic care, as far as living goes. And so we thought it was important to bring this to light and explain a little bit more about it. And so that's what we're going to do tonight. Anything to add?
Oh, I tell you, it's a great topic because a lot of people just constantly deal with a certain level of pain at all the time. And as I speak with patients, and many times these things can be resolved just changes in diet and different habits. So I just want to try to enlighten people that things you can make small changes that'll make a big difference.
All right, so getting into some of the definitions, inflammation defined, it's your body's process of fighting against things that harm it. So an example would be if you have an infection or injury, any type of toxins, that's your body's response to things that are trying to hurt the body or things that have hurt it. So when cell damage occurs, your body then releases chemicals, and those chemicals are going to trigger a response from your immune system. Your immune system, which is controlled and coordinated by the nervous system in the body, that then is going to release the antibodies, the proteins, increase blood flow to the area, and that process, the inflammation process, it typically lasts several hours to days depending on the severity. And this is in acute cases.
Okay, now chronic inflammation. Now this happens when the body's natural response, and it's when you have the acute inflammation, it's dealing with all whatever the injury is. But when chronic inflammation happens, when the waste products from the acute inflammation process can't get out of the body. And many times the big things that contribute to that are your diet, your body weight, hydration. Again, every health talk we talk about the importance of water. And here's another one. When your body can't flush all those waste products out from dealing with part of the healing process, then it turns into the chronic inflammation. So we need to keep things flowing, and water is such a key element with so many different conditions. And of course, the chronic inflammation, this constant soreness, can be compounded by smoking because of the toxicity, obesity. Again, when you're overweight, that increases the chronic inflammation by many-fold. Alcohol, chronic stress, constantly dealing with, we're dealing with a lot now with this pandemic and everything, and a lot of emotional stress. It, again, affects the central nervous system. So this leads to a constant state of inflammation that's not the healing inflammation like we like. This is the result of it's letting to linger too long. So you need to make changes to eliminate this lingering inflammation.
So some of the signs and symptoms of chronic inflammation, and as Dr. Thad said, these are just things that never take the time to heal properly or heal entirely, and so it's things your body puts on the back burner, and when they're on the back burner, you're not turning that back burner off. So that stuff's just going to continue to boil over or cook, whatever analogy you want to use. But you look at these signs and symptoms of chronic inflammation, these are things that a lot of people have on a day-to-day basis. Fatigue. I hear complaints all the time about, I don't have the energy that I once had. I don't have the get up and go like I used to have. Fatigue, the chronic inflammation, your body is spending so much time trying to clear out that inflammation somewhere in your body or all over your body in some cases, that it's not able to use the energy for the things that it used to use it for. Getting up and moving around, that nice young chipper feeling that you used to have. Inflammation could be playing a part in that. Another one, fever, a low-grade fever or a fever that comes and goes without really any explanation. You'll see also some sores or some rashes, things that pop up like that. Pain is one we see all the time. You come in and oh, I have pain at this time of the day, and then it just goes away. So a lot of times people will tie that back to, oh, well, if it's painful, I must have something out in my spine. And when it goes away, that whatever it was took care of itself. And so you can get into some trouble thinking that way, because only about 10% of the nervous system has the ability to even feel pain or sense pain. That's called your sensory nervous system. The rest of the nervous system can't send any pain signals. And so if it's a nerve that's being pinched or a bone that's out of place in an area that you don't have sensory nerves, then you're not going to have that. You're not going to know when that bone is out of place. And so pain a lot of times is from chronic inflammation is something that masks other problems or other issues. And you're also going to see a decrease in healing or decrease in immunity. Like we said, a lot of the energy, a lot of the focus for the body is going towards this chronic inflammation. And so the healing that you need in other areas or the immunity you need in other areas is just stolen away. It's stealing resources from one area and dedicating them to another area of your body.
Okay, now here's some different diseases that chronic inflammation is linked to. Many cardiovascular diseases with the heart, especially. Chronic inflammation is very devastating to the heart. Psoriasis, we see a lot of psoriasis, which is an autoimmune disease, but the chronic inflammation with that, which starts out as a skin condition, but it eventually attacks the joints. Depression, when you're constantly in pain, constantly fatigued, it has a great mental strain. So it definitely affects a lot of people who unfortunately deal with using medication to deal with their depression, and in turn it's a toxin to the body, so it actually increases the chronic inflammation. So you get in a vicious cycle with that. Cancer, very much linked with chronic inflammation. Kidney disease or renal disease. Again, talking with the autoimmune diseases, we see so much more of this in this day and age because of over medication. Our immune systems are out of whack due to being assaulted by chemicals such as overuse of antibiotics and different things within our food supply. Just many things contributing to a lot more to these autoimmune diseases than in years past. Asthma is another big chronic inflammation disease too. So those are just a few of the major ones, but there are many more. And the key is getting to the source of this chronic inflammation, and that's what we're going to talk about, things you can maybe change within your life and lifestyle that can help pull you out of this vicious cycle and get you onto a better path.
So before we move on, just a more of a photo representation of this. The inflammation, the red arrows being things that cause the inflammation, and the red arrow or the black arrows being things that inflammation causes. So we see the things that are caused by inflammation. It's going to lead to an increase in obesity, which then, as we already saw, is going to make the inflammation worse. So that's a cycle right there in itself. Infection is going to cause some inflammation. Just having diabetes is going to have some inflammation going along with it. Injury. That inflammation, gingivitis, cardiovascular disease, eye disorders. We went through all these, but very, very important and very, very big name things that are being caused by the chronic inflammation.
Okay, now we're going to give you a few tips to help control this chronic inflammation. Again, it's not very hard to implement. It's just making better choices. That's what it boils down to. Obviously, chiropractic care is going to be first and foremost. You have to have your body functioning at its best to deal with anything. Function is truly what health is. It's not necessarily just feeling great. Your body has to function at its best, and that nervous system controls that function. And that's not something chiropractic made up. That's just the way it works. You can ask any healthcare professional out there. They know that the nervous system runs the body. So we're just making sure that communication from the brain out to the body, from the body back to the brain again. So it's utmost importance, not waiting for back pain to occur, then get your spine checked, but keep that nerve supply at its very best all the time. The inflammation clearing of it is controlled and coordinated by the nervous system. And again, proper structure of the spine, keeping that spine in alignment, in those regular adjustments, keeping it there. It's easier to stay well than try to get well all the time. And so make that first and foremost in your dealing with any chronic inflammation condition.
All right. So another area that you could make changes to or make tweaks to would be in your diet. Eating foods that create more inflammation. That's a very common mistake, and that's in the typical American diet. Where you see a lot of processed carbohydrates, refined carbohydrates, the fried foods, the processed meats, the sugars, the vegetables, or the vegetable oil, canola oil, not vegetables. Obviously, we're going to see those are very good for. A lot of them are very good for anti-inflammatory, more of an anti-inflammatory diet. So, getting into those, some foods that you can pick that have anti-inflammatory properties to them would be something like extra virgin olive oil or avocado oil, grapeseed oil, instead of the vegetable oil or canola oil that, like we talked about. Some fish is going to have a lot of anti-inflammatory properties. Things like snapper, salmon, tuna, cod, halibut, bass, good quality, locally sourced, grass-fed beef is always going to be the best. As far as red meat is concerned, you want to stay away from the processed stuff. Any type of nuts, walnuts, almonds, hazelnuts, sunflower seeds, fruits. Some of the fruits that are more anti-inflammatory would be the berries, blueberries, cherries, things like apples. I see I have garlic on there twice. So eat 2 times the amount of garlic since I put it on there twice. Some herbs, basil, thyme, oregano. Pineapple is one that it's high in something called bromine, which is very, very, very good for inflammation. It's one of the most powerful anti-inflammatories known, and pineapple is very, very high in that. And so a lot of times if people are having trouble with inflammation or with pain, and they want to take something that's going to be like, say, an NSAID, a non-steroidal anti-inflammatory drug, I would suggest, maybe implementing some of this stuff in their diet. Increase your pineapple intake. That's something that's so delicious and easy to do, and you might get some benefit anti-inflammatory wise from it. Other things like dark chocolate, green tea, beans, onions, avocados.
Now we're going to talk a little bit about body weight. This is a huge factor in chronic inflammation. It's just linked. The more increase in weight, you're going to have an increase in chronic inflammation. When you lose weight, that allows those fat cells to shrink to a normal size, and it actually turns off the signals that trigger chronic inflammation. So that might be incentive to maybe drop back a few pounds as well. And of course, it's going to be much more beneficial as well. You lose the weight. That's going to take a lot of strain off your lower spine, especially hips, knees, ankles, feet. In fact, the studies have shown if a person is morbidly obese, chronic inflammation is increased by over 250%. So that is a huge factor. So there's maybe incentives for to maybe shed a few pounds to just get your body back on track dealing with this. Make these changes. And, of course, you start eating the unprocessed food, the weight may come off a lot easier as well. So you're really going to get a double benefit out of that. You're controlling the chronic inflammation through the foods, and then you're getting it by losing the weight too. So that could really make a marked change in your overall chronic inflammation.
So hydration, something Dr. Thad talked about earlier. Dehydration plays a huge factor in this chronic inflammation. The function of the water in your body, one of it is to help flush those waste products from the cells out of your body. So that heals that healing process. If you think about getting an area, say you're having surgery. Before they go in for surgery, what do? They want to clean that area first, and then they're able to go in and do the surgery. You want to be able to work in a clean environment when you're doing something like that, a healing process, things like that. So the water is just going to clean that area outside the cell. It's going to flush those waste products away, and it's going to take it and flush it out of your body and get rid of it. So without the water, the waste products are going to fester near the cells. The signals then lead to the activation of cellular signals, which is going to lead to that inflammatory response. If you're not clearing the toxins away from the cell, what is the cell going to send to the whole body? The message is, hey, I'm surrounded by toxins right now and I need some help. And so the body is going to say, okay, this cell needs help. There must be some sort of damage. There must be some sort of injury, some sort of infection. Let's devote some resources to take care of this problem, which is then pulling resources away from other areas of your body. So NSAIDs, like we said, non-steroidal anti-inflammatory drugs, these are taken to deal with chronic inflammation, but they actually cause dehydration. And so it could be a double-edged sword to where you're taking them to deal with the pain of the chronic inflammation or to decrease the inflammation, but it's dehydrating you, and so that's going to increase the chronic inflammation at the same time. So you may not have much effect or much benefit if you take something like that for your chronic inflammation.
Okay, activities of the inflammation. Studies have shown that moderate exercise is effective in reducing the inflammation. You can work out 4 to 5 times a week. Now, again, we aren't talking, preparing for the Olympics or anything, but, just moderate exercise. Few days a week of aerobic activity, walking, running, elliptical. Unless you're younger, I would running is something for the younger set. I would walking though is such a great exercise. You actually really mimic the benefit of running without the joint strain. And of course, elliptical machines. If you happen to be a member of a gym or something, which is a non-impact, you're getting that aerobic activity. Because impact, of course, that can lead to problems too. So make sure you listen to your body when you're doing these activities. And some activities, depending on your age and situation, might not always be a good fit for you. But definitely getting out and moving is such an important thing. And again, helping reduce this inflammation overall. You get out and get active. If you have a weight problem, it's going to help you lose the weight. You're going to be eating better. And you're going to find the pounds probably come off fairly rapidly. And again, you'll see a marked difference with the chronic inflammation. Maybe even a couple days a week of a circuit training or some weight training, just to help strengthen the muscles. And again, you aren't preparing for the Mr. Universe or anything like that. You're just getting those muscles strengthened. And once you reactivate those muscles, get them strengthened, the benefit you feel from that will probably be very encouraging to maintain this as part of your daily or weekly activities as well. So a lot of great benefit with that too, that they all kind of help each other in this total quest to control this chronic inflammation.
Yeah, absolutely. And again, don't let these words intimidate you. The key point here is just increasing the amount of movement, making small changes, small sustainable changes. Having a regimented workout would be like end goal. Maybe the first step is, hey, I'm going to get out and walk 1 day, or I'm going to get out and walk 2 days this week. And so that's a step in the right direction toward this. Is that going to cure your inflammation after one walk? Absolutely not. But it's going to put you headed in a course that is going towards decreasing that inflammation or setting your body up for success a little bit better. All right, well, that's all for tonight. Again, I'm Dr. Nico Rocco. We're here at Momemnutum Chiropractic in Grove City. With me is Dr. Thad Swales. If we could do anything to help you out, if you have any questions after this or questions in general, please don't hesitate to let us know. And we look forward to having you back next month for our next monthly health talk. Anything else to add, Dr. Thad?
No, I think we covered that pretty well there, Dr. Nico. I hope people get some good ideas and get started on just making some changes. It doesn't have to be massive change. Just change something every day, one little thing, and boy, over a period of time, you've changed a lot. You don't even realize it because it's just implementing slowly. For like I said, for exercises. Heck, you could start out just by maybe when you go to the store, parking at the end of the parking lot and just walking, down and just that and just. Again, just start implementing, just making it a little bit better each time. And once you start getting the benefit of that, and then it's just like with your food, just make changes. Just pick a better substitute for maybe some of the stuff you're eating, and then you kind of just get you get that momentum going. And then these changes really add up over time, and in no time you're feeling a whole lot better and going in the direction you really need to go. So I hope this helps you, and Hope you folks are all staying well. And again, if you have any questions, please, don't hesitate to ask us. We're here to help, and it'd be a pleasure to help you along in your health journey.
Absolutely. Thanks for tuning in, everyone. Have a good night.